everyone. So I've been asked to make a quick video talking about how my clinical experience has guided my decision in what type of specialty I might want to pursue. I happen to be at the hospital right now in an on-call room. So let's get started. So during CCC, I did CCC first, and I was in Owasso. So Owasso happened to have a large amount of different specialists. They had urology, they had OBGYN, gastroenterology, heme-oncology. They had a lot, and a lot of those specialists kind of opened their doors to us and kind of would say like, oh, if you're interested, come and explore this, or come be in the OR with me, or come into clinic one day. And I would say one of the things you all can do is, if someone does make a comment like that to you in passing, even to take them up on it. That's a really great learning opportunity. That also happened to me here in Saginaw. One of our lecturers during my surgical rotation happened to be a vascular surgeon, and we don't normally work with him maybe until fourth year. But after his lecture, he said, oh, well, normally I'm in the OR on Tuesdays and Thursdays, so if anyone ever wants to join, feel free. It was kind of just like a statement he made in passing, but I ended up taking him up on it because I had a slow OR day, and it was probably one of the coolest surgeries I was able to scrub in on, and he gave me some perspective on some questions I asked him about his specialty and things I was interested in. So definitely take advantage of people that reach out to you, because as a medical student, there's a lot of things going on in the hospital, and you really need to take charge of your own experience. Don't expect anyone to come and say, oh, you're going to be a GI physician, let me take you under my wing, let me show you everything. That might happen if you're really lucky, but a lot of the time you really need to take that initiative and be open to a lot of different things. You may never know that adolescent psychiatry exists, or that there's physical medicine and rehabilitation that specializes in pain, or unless you are open to those opportunities. So definitely keep an open mind. Also, don't be afraid to tell people what you're thinking. I know some students don't like to tell attending, especially when they're on a rotation with them, that, I know I'm on a surgical rotation right now, but yeah, I'm definitely only interested in peds, because they don't want to be perceived as a non-surgical candidate. But for me, I've been really open about my interest in emergency medicine, and a lot of the attendings have then been like, oh, well, so for you, if you're interested in emergency medicine, this is a perspective that you can look at the patient and gain from the patient from that viewpoint. So that's been helpful. Also, they'll give you feedback. Maybe their wife is a physician in that field, or different things like that. So I have found that it's helpful for me to be open with people about things that I have been interested in. Other great opportunities is to go to conferences. So if there's a couple different specialties that you've kind of narrowed down, a lot of the times there are national as well as regional conferences. For me, I'm interested in emergency medicine, and there's something called EMRA, which is the Emergency Medicine Resident Association, and there's actually a medical student section. So I got involved with them, and through them I was able to find a conference where there was a special medical student section where I went and I learned a lot, and I was exposed to a lot of different residency programs and different pieces of advice from physicians, and I gained a lot of information about the residency, and you meet the people that are in the field. So you see the types of people that you would be working with, because another thing that I've heard is that there's different personalities, and different specialties are known for attracting different personalities, and I think this is true. Those tests that we take that piece apart our personality, I think those can play a large role in kind of decision making. Not the be all end all, but the questions that are, do you thrive off of getting quick results, or are you the type of person that values long-term results that really make a difference? There's different questions like that that can kind of help you guide where you might be happiest as a person and with the personality that you have right now. So definitely pay attention to the places where you feel most comfortable. If things are interesting to you on the wards, or in the hospital, or in the clinic, if those things excite you, you want to read more about them, definitely pursue those things. Don't ignore your extreme interest in OBGYN just because you thought that you would always be an orthopedic surgeon. Pursue those things, make yourself aware of the different specialties out there, know the different things that internal medicine doctors can go into, because they can go into a lot of different fellowships further on. Know the different capacities that family medicine physicians can practice in. There can be procedural based practices, there can be practices that see a lot of children. There's different things that you can make work. So my final pieces of advice would just be, in summary, to pursue those opportunities when people reach out to you, and keep an open mind. Utilize your resources such as conferences and other meetings to really get to know the people that are in the field, and really think a lot about your personality, what kind of needs you have, what you like, and in what kind of environment you can see yourself thriving. And just be relaxed and be ready to take it all in, and enjoy the ride. So, all right, hope everyone's doing well.